Good afternoon, everybody, and welcome to today's meeting of the Adults and Communities Overview and Scrutiny Committee, which is taking place at County Hall in Glenfield. Though some officers will be joining online via Microsoft Teams. As usual, this meeting is being broadcast live via the County Council's website, and it will also be available for viewing after the meeting. Can I please ask that all officers and members mute their microphone until they wish or are invited to speak. I've received apologies from Mrs. Broadley, Mr. Champion, and Mrs. Broadley, who is being substituted by Mr. Mullaney, Mr. Champion, who is being substituted by Mrs. Fryer, and Mr. Chapman, who is being substituted by Mr. Frisbee. So can I thank all those three for substituting to make sure we have a full attendance at the meeting. And if I can just, we have the Cabinet Lead Member and the Cabinet Support Member with us. And Mukesh Barrow from Health Watch will be joining us by Microsoft Teams. For those that are aware, or I don't know, I attended the funeral this morning of a former councillor, Councillor Barry Garner, who I think served on this council for some 20 years and was twice chairman of this council. So with your indulgence, member, could I please ask that we all stand in a minute's silence? Thank you, members. And officers, sorry. It's all right, just as a slight aside, I represent the division that Barry Garner used to represent, and I've known Barry for some 30 years, and he was very much a member of this council, and he would have very much welcomed that mark of respect from you all. So I'd like to thank you on behalf of not just him, but his family, who are going through a very sad day today. We now start the agenda with item 1, which is minutes of the meeting held on the 7th of June, pages 5 to 10. Do I have from those that were in attendance a proposer for the minutes?
Yeah, I'm happy to propose.
And a seconder? Thank you. All those in favour? Thank you. Right, agenda item 2, question time. I've received no questions from members of the public. Agenda item 3, questions asked by members under Standing Order 7.3 and 7.5. I've received no questions from members. Agenda item 4, to advise of any other items which the chairman has decided to take as urgent elsewhere on the agenda. I have not been notified of any urgent items. Agenda item 5, declarations of interest in respect of items on the agenda. I know we have one from Mrs. Wright, which I will take first.
Yes, I'd like to declare a personal interest just in terms of social care in general. As the council knows, I am employed by Brown Jacobson. I am involved in the social care sector, and indeed I am a champion for a social care organisation.
Thank you, Amanda. Do any other members wish to declare any interest? Right, thank you for that. We're now on to agenda item 6, which is declarations of the party whip in accordance with Overview and Scrutiny Procedure Rule 16. I have been notified of nothing by the whips. Agenda item 7, presentation of petitions under Standing Order 35. I have received no petitions. So now we're on to the first substantive item today on the agenda, which is commissioning and procurement of home care services as set out in your agenda pack or online, whichever you're looking at, on pages 11 to 18. And this is in the very capable hands of Nigel Thomas, Assistant Director of Adults Communities. who will present the item. And I believe he's being supported by Kate Revel, Head of Services for Commissioning and Quality, if questions or anything else she wishes to input. So thank you, Nigel.
Thank you, Chair, and good afternoon, everybody. So the purpose of this report is to update members of the committee on the progress made with the procurement of home care services following notifications to award. And what the report does is it summarises the outcome of the recent tender for integrated home care services. And this is a procurement that's done in partnership with Leicestershire Clinical Conditioning Groups, or CCGs. And that will create a new framework for providers, which will come into effect from the 1st of November. And this Home Care for Leicestershire framework will replace the current Help to Live at Home framework that will expire on the 5th of November of this year. I won't go into the details of the previous decisions. You'll know that a number of papers and reports have been through committee and cabinet. But it is, in terms of the background, just worth noting that all existing Help to Live at Home arrangements, which is the old framework or the exiting framework, will be ending on the 31st of October through a notice to terminate. So the new framework, Home Care for Leicestershire, is being jointly commissioned, as I've said, and the aim of it will be to provide ongoing care following reablement by the Home Care Assessment and Reablement Team, or the HEART team, where this is assessed as being appropriate. And this model of service delivery, Home Care for Leicestershire, is based on an open framework of providers who have bid for work within the county. And the county has been strategically divided into 14 geographical areas or zones, each requiring at least 2 providers to provide care in those areas, but with no upper limit. Now, that's a slight different from the existing arrangement, which split the county into 18 lots with a lead provider in each lot. So there won't be a lead provider. There'll be a number of providers in each geographical area, which will be able to, which will provide care. When we went through the procurement process, we obviously had to follow due process, and providers were assessed against 7 method statements covering the key elements of the service specification. And those were undertaken by an evaluation and moderation team between the 22nd of May and the 7th of July. And they tested a range of responses against requirements set out in the service specification, and providers were asked to set out how they were going to meet those areas. And as part of that work, the outcome of the financial evaluation was applied to ensure that those applicants passed the method statement evaluations. The department's senior quality manager reviewed the Care Quality Commission's, which is the independent regulator for health and social care, status of the bids to make sure that there were no concerns with CQC categories in either the safe or well-led categories of CQC assessment. So moving on to the award summary, which you can find from paragraph 17 onwards. Looking at home care services, you can see that a total of 49 providers passed all the selection criteria, and of which 32 of those were existing providers, i.e. those that we already do business with 17 that are new. So those are which we don't currently do business with. And of the existing providers, of those 32, all 7 of the current lead providers got through onto the framework, with 8 of the supplementary providers and 16 of the 38 contingency providers. And just to explain a little bit about the supplementary providers and contingency providers, which are in the current framework. Contingency providers are essentially providers who've got a contract with the county council, which is in effect a spot contract. And this means that they've got no guarantee of work, but can pick up work as and when it's available. And the exception providers, those are providers under the current framework who have a contract for a specific package of care, and a price for that package of care has been agreed, but the provider can't pick up any additional work from the council in the current system. So that's going to change because it's a more open framework. There will no longer be lead providers, contingency providers, and so forth. Just moving on to paragraph 18, just to look at the continuing healthcare element. These are packages of care which are commissioned by the council on behalf of the CCGs via a Section 75 funding agreement. And 15 agencies have bid successfully to provide these funded CHC packages. This does represent a reduction in the existing number of CHC providers, but we are working with CCG colleagues to determine the standards and checks required for the processes of assessing and adding further CHC capacity during the contract mobilisation period. So rather than waiting until the framework reopens, which is generally when new providers can bid for contracts, the final contract which will be issued will be amended just to clarify that, as well as the framework providers being offered the opportunity to demonstrate their capacity to move into zones, they'll also be able to demonstrate their ability to deliver CHC if not successful in the initial tender. The table on paragraph 20 just really gives you an outline of the zones, which are on the left-hand side, starting with Ashby and Colville, and then the number of providers that have successfully bid in there. And just for information, the rest of the columns gives you an idea of which are in the old system, the lead providers, the supplementary providers, the contingency and the exception providers, and the new providers. But really, we're just looking at the total number of providers in each of the zones there. There's interest, as you can see from that, there's interest of between 2 and 25 bids in all of the zones, and the popular areas, as you might expect, are in the urban zones such as Oadby and Wigston and Loughborough, with the lowest levels in the traditionally sort of areas where it is difficult to access care or commission care, but in Bottisford and Harborough, the Harborough rural areas, where there's 2 providers and 3 respectively that have expressed an interest to provide care in those areas. But it's worth saying at the moment that until our contract managers have all of the mobilisation meetings with the new providers, this will be a changing picture. So we don't know the exact numbers. That will change slightly depending on the further conversations that we're having with those successful providers, just to get an idea of, just tweak that that spread across the piece. But it's just making the point that that can actually change. So in terms of the next steps, all of the new and existing providers have had their initial meetings with us, and we'll be planning to look at their capacity to deliver care, and that they've got that in place. The Home Care for Leicestershire framework has been set up to allow the addition of additional providers after the 1st of November. So at any time after that point, we can decide to reopen the framework to request any further bids to provide care. And in conjunction, those milestones are set out on paragraph 27. Moving on to resource implications, just making the point in the report that the price bands for the new contracts have been determined to reflect the different operating costs across the county. There are no resource implications for overall spend of home care packages due to the implementation of the new contract prices, as the rates were set such that the overall cost would be the same as the Help to Live at Home should volumes remain the same. However, it is worth noting in paragraph 29 that the authority does have a significant growth in demand for home care since the start of the pandemic, in terms of both numbers of new service users and increasing service needs. And this has led to home care expenditure under Help to Live at Home being significantly higher than that budgeted for 2021 and to date in the current financial year. Paragraph 32 begins looking at the risks and issues. There is a risk that current providers who are unsuccessful, who didn't bid, may seek to hand back packages of care before the new framework start date, requiring the council to transfer the care to the new provider before that start date. And we'll be using existing contractual arrangements to bridge any such gap, and where possible use current providers who've already been appointed to the framework. Furthermore, there's a risk that exiting providers will leave a gap in market capacity in the event that new providers are unable to sufficiently mobilise by the 1st of November. To mitigate this risk and manage variation to future demand, the agreement is worded in such a way as to focus on the County Council's discretion in deciding when to invite new bids, and enables the Council to consider zone-specific requirements as well as wider emerging issues such as providers failing to demonstrate readiness to commence operating at the start of the contract. So that really sets out where we are currently with this procurement. We are undertaking further analysis to ensure that there is sufficient market capacity to meet current and future demands across all zones. Thank you, Chair. Happy to take questions.
Thank you, Nigel. Who wants to go first? Mr. Mayor. Before you start, could I just ask Mr. Hills to turn his microphone off just to make sure we don't get any feedback? Thank you.
Thank you, Chair. I just wanted to touch on the contract rollout actually, because we're here in September now, but the contract mobilisation period has started on the 23rd of August. Have we already given out contracts to some of these new providers and the existing providers already? Is that happening? And if that is so, why are we getting this report now, and why didn't it come to us earlier? That's the first question. Thank you.
Okay, yeah, I mean, yes, the contracts are there. The reason why you're getting this now is because it takes quite a long time in terms of the process of going out to tender. It's particularly with this case where we think we had about 140 bids from a whole variety of providers. There are obviously confidential commercial confidentialities involved, and it's taken up until now and it's an ever-changing picture, so we are it has taken quite a while to pull the information together to enable us to get to the point where we know who's got through the method statements, who's got through the quality checks, and then to write to them and set up. So, we probably, we could have bought the report earlier, but there probably wouldn't have been much data in terms of just giving you some more specific numbers, particularly around the spread of providers per geographical area.
My second question is to do with actually that provision in geographical areas. Obviously urban areas, lots of providers, but I noticed one that only had 2, for example. So what's the contingency if one of them fails or is unable to take on extra work should it arise in that area?
Okay, so what would happen there? Obviously, those areas have traditionally been and historically been always areas where it's difficult to get providers, mainly because of the geographical travel involved, as I'm sure you appreciate. What we would do is obviously look at where, if we did need care in a given area, we would have to then, approach other providers in terms of whether they're able to pick up care in that area. I don't know whether Kate's got anything that she wants to add to that in terms of any more specific detail.
Yeah, I think just to say that the pricings of care per hour per zone also reflect a rural and urban split, which means that as long as the providers, albeit a limited number, within the less popular zones do provide the care that they have bid to do, then we know that they are receiving a fair price for the care that they are delivering that reflects the transport challenges associated with the areas, etc. And so we feel that that makes it a sustainable offer. There are ways in which we can, for example, in the future, reopen the framework once it is all embedded a little further. So I think although those figures are quite different in terms of the areas of high interest versus the lower interest, we do feel we have the geographical coverage at this point that we need, with the opportunity to develop it in the future.
Are you happy with that, Mr. Mayor, or do you wish to come back?
Yeah, no, I'm happy with the response. I think that's clear. I just had one further question.
Yes,
on another matter. Sorry, and that's to do with recruitment. We've heard in the news recently all sorts of issues with recruitment, but the care sector was an issue before it all happened, and I think this is just snowballed. So what would happen if a provider failed to recruit sufficient workers, let's say care workers, to fulfil the packages that they've bid for, or if they withdrew because they couldn't provide that care because they didn't have the workforce? What are we doing, and how proactive are we in monitoring these companies that are taking on the packages?
Okay, so as we do now, we have ongoing, as we'll see in the next paper, we'll have ongoing conversations with all care providers. We do have the Inspired to Care team that would help and offer some certainly longer term support in terms of any recruitment issues, and they are available just to help with that recruitment area. And obviously what's happening now is we're going through those conversations to make sure that sort of the providers do have that capacity. Again, if that if that doesn't, if providers don't, or we feel that sort of they don't have that capacity, then obviously we'll have to go back and consider sort of in terms of offering to others, and also at some point reopening the framework, which we want to do sort of probably sometime in the new year.
Thank you, Mrs. Wright.
Yes, hello, Mr. Thomas. I just have a question about the transition period between the two frameworks. It mentions in your paper that I think there's a re-enablement period of time that's provided by Home Care Assessment and Re-enablement Team. It seems a very short period of time to effectuate such a transition and make that transition as smooth as possible, especially bearing in mind that, say, for instance, in Hinckley, there is 50% of the providers that are new providers coming in. Can you tell me a little bit about that, and whether there's going to be any, say, mentoring of provider to new providers, or any schemes that have been set up in that regard to ensure that smooth transition? Because obviously we want to make sure there is a smooth transition and we're not having to put out a great deal of fires.
Yeah, thanks. I'll hand that over to Kate in a while. But as I say, it is a big procurement. Members will recall we did delay the procurement because of COVID last year. We are having those conversations. What we will do is to ensure that we're having those conversations with, for example, those people that perhaps weren't successful with getting on the framework. We're likely to want to continue to work with those people, and we will look to how we can extend any contracts with those people to enable us to still do business with those whilst we're going through any transitional arrangements. I'll hand over to Kate just in case there's anything that you wanted to add, Kate.
Very little additional to add to that, Nigel. You've really summarised that. I mean, just suffice it to say that we will be working very closely with current and exiting providers, with those that are coming in. In some cases, it is of course a little more fluid than that, in that we have providers who are continuing or extending out their geographical reach. Others who may well wish to apply to rejoin the framework imminently, and the reality is may actually not experience a lessening of work from us for a significant period of time. So that it is all quite organic. There's a large number of providers involved. We've got a team that are working on this, as well as officers dedicated to the transition. So just to provide assurance to the committee that there's a significant amount of resource deployed in managing that transition between old framework and new framework, to ensure that there's minimal disruption or no disruption to people who use the services.
Any further questions from members? I think this is a subject we've looked at several times. I'm sure that the committee would welcome, in due course, sometime in the new year, an update as to how well the transition went and how the new providers are going. Would that be the wish of the committee, that we will want to just an update to take situation where we are and where we've got to? If I could then thank the officers on that one, we now move on to agenda item 9, which is care home quality, as set out in pages 19 to 36 of the agenda pack. This is a report that has been requested just to give us an idea of what the current situation is in the care home market in Leicestershire, and how it might move going forward. So back to you, please, Nigel.
Thank you, Chair. What this paper does is give an overview of our assessment of the quality of care homes particularly, but also references domiciliary care as well, and looks at how the local authority supports the market to sustain safe care and develop the quality of care. It's quite a lengthy report, so what I'll try to do is just pick out some of the salient points to leave enough time for questions and any discussion. Just in terms of, it's worth reminding people that the activities described in the report are underpinned by the Council's strategic plan and the departmental strategy, the latter of which was approved by Cabinet last September. And just in terms of the background, again, there's been a number of reports. This committee had a report in last November, which looked at an in-depth description of the pressures that the market was facing as a result of the pandemic, and a further report in March gave an update to that. It's worth reminding the committee that our Care Act responsibilities include market oversight, including understanding the financial and other issues arising from any circumstances which might impact on providers. And also the role of the Care Quality Commission, the CQC, that, as you know, is the regulator for social care, and they monitor, inspect and regulate the services to make sure that they meet the fundamental standards. And as you'll see in the report, they've introduced a new strategy as well, which will change the way that they approach those responsibilities. So moving on to the main body of the report, paragraph 8 onwards really just looks at what the current position is pre-pandemic on paragraph 9, and that sets out that as of March 2020, before the pandemic fully started, we had 296 total registered services, 178 care homes, 171 of which were operational, and 118 home care providers, and that includes extra care and supported living. And that's compared on paragraph 10 with the current position, very similar, 295 registered services, a reduction of 1 service, an increase of 2 care homes, 176 173 which were operational, and 119 home care providers, an increase of 1. And that's set out in the table on paragraph 11. Overall, the reduction in services rated good overall by the CQC. There's been a reduction from 75% overall to 71%. And this has mainly been in the care home sector, where there's been 8 fewer homes rated as good. There has been an increase in providers rated as requires improvement, but it's worth noting that this is a result of some providers who might have moved from good to requires improvement, but also from providers moving from inadequate to requires improvement. So in terms of that scale of CQC rating, that sets that out. We have seen within the county a significant decrease in homes rated as inadequate by the CQC, from 5% to 1%, and that's a decrease of 7 homes. And paragraph 15 onwards looks at how that compares within the regional and national context. And we've compared against comparator authorities, which is set out in paragraph 15. And that tells us that we've got fewer outstanding care homes, 2% in Leicestershire, against 5% to comparator authorities and 4% nationally. However, the county's also got fewer homes rated as inadequate compared across England as a whole, 1% in Leicestershire against 4% rated as inadequate nationally. And the table below paragraph 16 sets that out. Paragraph 17 onwards looks at, reflects on the ongoing challenges. And as we know, the period over the last 18 months has been extremely difficult for providers, and it's worth saying that they have done an exceptional job in trying to maintain the standard and quality of care. And paragraph 18 really just summarises some of the broad challenges. And I'm not going to go through all of those, but you can see clearly outbreaks of COVID-19, increased mortality rates during the period of the pandemic. We've touched on workforce availability, reduction in permanent admissions to care homes, resulting in higher vacancies, understanding and applying government guidance. The guidance changed regularly, and providers were informed of changes through weekly bulletins, phone calls and so forth, but it was challenging for them having to change their processes on a regular basis. And since that time, there has been some improvement since the last report that came to this committee. For example, the availability and pricing of PPE has steadied and stabilised. And that currently is free for providers, and they access that through a portal until March next year. There's been fewer, less extensive outbreaks of COVID-19, fewer deaths, and regular and better availability and speed of COVID-19 testing, and obviously the widening out of eligibility for the vaccination have all been improvements since the last time we looked at this area. And paragraph 20 just outlines some of the support that the County Council offers to those in terms of mitigating those challenges. Again, particularly given funds to spend through Infection Control Fund to help isolate residents in their own care homes, weekly bulletins, information about government guidance, infection prevention and control support from a specific team of specialists in this area, and that includes visits to homes to offer support and advice. And repayable advance payments have also been made to providers to provide upfront support to mitigate any immediate financial pressures and to try to stabilise the market. And increasingly now, our workers, including our quality and contract officers, are now again able to visit care homes in person to assess and support with support and advice, particularly around things like PPE, infection prevention and control. Paragraph 24 really just looks at some of the intelligence gathering and focuses on the work of that quality and contracts team. We've invested in additional contract quality officers to support the implementation of a RAG, red, amber, green system to help us look at the state of a variety of providers. And you can see the sort of definition of the red, amber and green in paragraph 24. And this includes, but is not limited to, the CQC status. That report is rated, and then we agree on what actions are required in terms of what levels of intervention we might make. Contracts officers review all the information which is received about a provider, and this includes provider performance, monitoring forms, any whistleblowing concerns, safeguarding alerts and so forth. And this is reviewed monthly and escalated where we feel that there is risk and some intervention needs to take place. And as people have started to visit services more, we've seen more information being shared, which gives us a better oversight of the provider and an up-to-date picture of the current quality status, and enables us to do some prioritisation of work across the whole area. Paragraph 31 to 35, just for noting that the CQC have published a new strategy for the changing the world of health and social care. And that's really, their strategy is really looking to make regulation more relevant to the way that care is now delivered, with an aim of being more flexible to manage risk and uncertainty. And on paragraph 33, you can see that they've divided that up into 4 main themes: people and communities, smarter regulation, safety through learning, and accelerating improvement. And we meet regularly with CQC officers, both at a strategic and an operational level, to really discuss any strategic and day-to-day operational matters. And we will continue to undertake that work. Paragraph 36 looks at the market sustainability and looks at the concerns where we need to consider interventions. So home closures, we've offered support to all providers that are offering severe financial challenges, as we've seen. And to date, very few have actually requested support, and none have been forced to close as a result of insolvency. In terms of self-funders, Leicestershire has a strong self-funder market. Half the beds in Leicestershire homes are occupied by self-funders who may pay fee rates at a different level than those paid for by the council. And occupancy, that gives you an idea of where the occupancy levels lay before COVID. Those took a dip, but it just shows that that's beginning to recover and recoup itself in terms of the potential vacancies available. Paragraph 40 onwards looks at the provider engagement, and we've seen that we continue to have regular meetings, phone calls, bulletins with providers to help give bespoke support and address any queries that they might have. And we continue to hold those meetings to make sure that we've got that two-way flow of information. Paragraph 42, just worth noting that we're currently developing and finalising our commissioning intentions, very much based as currently in terms of making sure that its emphasis on what we commission is on independence and independent living, with increased use of asset-based, community-based support and strategies. Paragraph 46 looks at fee uplifts for 21-22. And we know that care homes particularly have faced significant increases in costs, many of them mitigated by that additional funding, but it's still very much an ongoing issue. And what we're saying in this, and it's covered in paragraph 50, is what we would normally do is do a regular fee uplift following a more comprehensive fee review. But because of we feel that the care home market hasn't recovered enough from the impact of the pandemic, COVID-related costs and the Department of Health and Social Care funding to mitigate them are still in the system. We feel that it's not the right time to undertake a review to establish those rates. And what we're proposing is, and would like this committee to note, is that we're recommending that we delay any fundamental review until April next year, when we see that, you know, sort of hopefully, depending on what happens, the market settles down a little bit. Paragraph 52 onwards really looks at the issue of COVID vaccination in care homes, a very live topic, as you'll know. The table on underneath paragraph 54 really sets out the percentages of home care residents and staff who've received first and second doses of the vaccination. And the table compares what our position is against those of the East Midlands region and England overall. The results, as you can see, are generally in line, if not above, East Midlands and England rates, with the exception of older people's home staff, where we're slightly under the regional and national averages, but everywhere else is a fairly positive picture. And we're continuing to offer every encouragement and support to make sure that providers and staff, providers encourage workers to take up their vaccinations. And the paragraph 56 looks at some of the things that we're doing, ranging from virtual question and answer sessions, frequently asked questions documents, weekly email updates, and so on. Paragraph 59 just touches on, there is now, as you know, the requirement for those working in a CQC registered care home environment to be double vaccinated, unless they have an exemption confirmed by the government, and this was confirmed in late July. And the key dates for that is that really next week, the 16th of September, is the last date for care home workers to receive their first dose in enough time so that they can be fully vaccinated by the 11th of November. And care home managers are working hard to prepare staff and services to ensure that they are compliant with that new law. Our own director and the Director of Public Health have written to care home managers to set out some of those key considerations, and we will be looking at the situation next week to get a feel for what the impact of that may be. We're undertaking detailed work across all of the operational care homes, again, to allocate a red, amber, green list rating, principally focused on the likelihood and impact of possibly reduced number of staff able to work in the setting. And this will help us, again, prioritise that support. And paragraph 65 just outlines a menu of the types of interventions that are being developed, which can be used by our officers, which includes detailed discussions with GPs, training, support with recruitment and retention, business continuity planning and signposting to specialist resources. As we said, a further appraisal will be following after the 16th of September. First dose milestone has been passed, and that will give us a more clearer picture of the number of workers who've got no prospect of a full vaccination by the final 11th of November. And Kate may give you a little bit more detail on that position. Paragraph 69 looks at the response to provider instability and failure. Obviously, that naturally has increased over the pandemic for a whole range of reasons that are sort of set out in the body of the report. Providers are testing staff up to 3 times a week and residents monthly. There is a local exemption from isolation policy that's been developed based on national guidance, which allows exemption in extremely exceptional circumstances, but that process is there. There is support for all homes during an outbreak from information IPC and quality and contracts officers, and advice and support given how to ensure infection prevention control methods are appropriate to reduce the spread of infection. Providers are supported with recruitment through the Inspire to Care team, as I've already mentioned. And in the case of where it may look likely that there is failure, there is a mutual aid agreement where all health and social care partners come together to ensure that people are cared for safely. This includes health partners, CQC and our own internal direct services. Paragraph 82 just covers the resource implications. We know that at the moment, care home providers are benefiting from free PPE until next year. We don't know exactly what's going to happen at the end of next year, but obviously we're having those conversations with the government. We are committed to considering providers reasonable additional costs from COVID-19 where they've not been met through existing national and local funding streams and initiatives, and that's on a case-by-case basis and based on the evidence that's presented. And it's worth noting that the residential expenditure budget is 98 million. And currently the forecast spend is 105 million due to additional costs, mainly relating to COVID-19 and the increase of short-term service users. So to conclude, the care homes market, as we can see, has been substantially impacted. It is an ongoing scenario, and we will continue to support providers via workforce support, maintaining communications and dialogue, and financial support where appropriate. Thank you, Chair.
Thank you, Nigel. Members, any questions? Right, we go to Mr. Frisbee first.
Thank you, Nigel. I'd just like to go have a look at review paragraph 9 pre-pandemic. It identifies there 7 less homes were operational. Is there a common theme? Is it provider or is it authority that would render those inoperational?
I'm going to give that one to Kate, I think.
My apologies, I was just trying to find the right paragraph. Would you mind just repeating the question?
Sorry, Kate. Yes, it's paragraph 9, which is pre-pandemic.
Yes.
There was a reduction of 7 homes. They were identified there as inoperable or inoperational. Is there a common theme? Is it the provider that has made that decision that they're inoperational, or is it indeed the local authority that has made that? Or is there another reason why we've got less than we started with?
Yeah, I think that so this partly relates to the technical definition of a care home. The 178 is, as I understand it, the number that is registered with the Care Quality Commission. Some of those, so 7 in the pre-pandemic position, will have at the point of time that this snapshot was taken be mothballed. They might be in the process of being sold to another provider. In some circumstances, there are reasons why they may not be showing as operational that are other than what I've said. There's no particular provider relating to those 7. They often just reflect particular business positions or interests at that time. That in itself is no cause for concern. The local authority themselves, as you'll be aware, can't close care homes. Our role with care home quality and oversight is with our Care Act obligations in terms of the overall buoyancy of the market and support to the market. The Care Quality Commission is the regulator, and they have the power following inspection and when it's duly evidenced and the provider's had an opportunity to respond to those concerns, has the opportunity to what's called remove a location, which in effect means close the home. But of those 178 within that initial position, those are registered care homes, and there's no indication about particular concern between the difference between the 178 and the 171. It might just be that the building is empty because of a business change.
Thank you, Nigel. Thank you, Kate. Thank you, Chair.
Mrs. Wright.
Hello, Nigel. Yeah, I have a question in relation to paragraphs 10 and 11. And I'm looking at the graph at 11, showing essentially our outstandings remain the same. Good providers have dropped. Our requires improvements have increased. And I was just wondering whether this chart is going to look somewhat different after we have changed pathways that we referenced in terms of the former agenda item, in terms of the home care services of which this provides part, because I noted in that part of the method statement evaluation, one of the 7, is the CQC element, and that it has to be the criteria of either safe or well led in that. So would that mean that in relation to the 119 home care providers that presumably that graph also encapsulates, that we won't be getting the requires improvements inadequates? I don't really know what the unrated relates to. Presumably that's not CQC applicable. Is that right? Sorry, that was a bundle of questions.
That's okay. That's fine. I guess, sort of, yeah, this is a snapshot in time. We don't, we will, obviously, I'm sure there'll be further updates to this committee on the sustainability, and we'll see that play out following the, any changes in the home care for Leicestershire procurement. Certainly, we were picking out specific CQC ratings as part of method statements in those areas to make sure that that anybody that's coming onto the framework is in a good position. So yeah, I mean, it may change. This is a snapshot at a particular time. There will be no doubt further updates on market sustainability as we go forward. I don't know whether Kate's got any sort of additional comments there.
Yes, absolutely. The question about unrated. Within the pandemic period, the Care Quality Commission did not operate their usual methodology in terms of being able to go out and inspect providers in the way that they would during a business as usual scenario. And therefore, any new providers who were attempting to register would find themselves for a period unrated because the CQC were not able to get out and run the checks and balances that you would expect them to. And that's why they're featuring as unrated. And as Nigel has said, the committee may wish to ask for periodic reports on comparative information on the various CQC ratings of providers within Leicestershire so that you can keep an eye on that trend over time.
Can I just follow up in relation to that? We saw on the last agenda paper that Hinckley, for example, has 50% new providers. Are you telling me that those 50% are unrated and don't have a track record in terms of CQC evaluation?
No. So with regard to the last agenda item, that relates to, so we described new providers as being providers coming for the first time onto the Home Care for Leicestershire framework. All providers bidding for the Home Care for Leicestershire framework had to demonstrate that they were registered with CQC.
Thank you. That's all the questions I have.
Thank you, Madam. Mr. Meyer.
Thank you, Chair. I just wanted to touch on COVID vaccines for care home staff first, and then I'll move on to something on the budget, Chair, if you allow me. So vaccination rates for staff in general is good, but this requirement for the 1st of November is going to cause stress, I think, to care homes because certain staff won't won't want to take it, no matter if it's their job on the line. And I think you touched on it to say they're working on having reduced staffing capacity, basically. But is that feasible? You know, if 10% of the workforce don't turn up on the 2nd of November, will care homes be able to cope and manage? And if so, why can't they manage now?
Thanks. I think it's probably fair to say at the moment that the position in Leicestershire is quite positive. You know, we've got high percentages of staff and residents that have had, you know, sort of first and second doses. Inevitably, there's going to be people that, you know, for whatever reason, choose not to take the vaccine, and they will make their choices in terms of their future employment. What we are doing at the moment is working closely with providers and health colleagues in terms of mitigation plans to help and support providers in any way that we can, in terms of you know, sort of how they may address that. And as I've said, you know, sort of we'll have a clearer picture of that once we reach that first dose milestone next week, to get a feel for, you know, sort of what that picture is. But I think, you know, just in terms of Leicestershire, I think I'm right in saying that, you know, and Kate, I think probably be a bit closer to the detail in terms of the numbers, but we're in a fairly, you know, sort of positive position when you compare us with maybe other parts of the country, but nevertheless, it's still a very real issue. Kate, I don't know whether you've got anything else to add in terms of the vaccination rates.
Yes, that's right. And members will have seen the detail within the report, which explains the work that we've been doing with providers around vaccination since the start of the COVID vaccine becoming available to that cohort 1 of workers, which includes care home workers in December 2020. As we get closer to what we now know to be those 2 deadlines, the 16th of September for dose 1, if people haven't had it already, and the 11th of November to have dose 2, and the only people working in care homes from that point, be they actually employed by care home, the care homes themselves, or visiting to deliver a service, will be double jabbed. So as we get closer to those deadlines, we've been working very closely with the sector around further support that we can give to them. We've carried out risk rating for all of the homes within Leicestershire to understand those that we need to give particular attention to and particular support. And as Nigel said, once we get past that initial 16th of September deadline, we'll have more of an idea as to the real risks associated with homes who have not succeeded in having sufficiently vaccine confident staff, such that they're able to provide the rotated staff that they need to from the date that this regulation becomes mandatory from the 11th of November. But it's subject to a huge amount of work from Leicestershire County Council, across LLR with our other local authority partners within Leicester and Rutland, and for the healthcare organisations with the NHS providing the COVID vaccination programme, but also who deploy staff into care homes. They are also ensuring that their workers are double jabbed.
It's probably worth adding as well, as Kate said, you know, that obviously includes our own staff that will be entering care homes. You know, sort of again, you know, sort of vaccination rates within the workforce are very positive at the moment.
Yes. Final question on budget, really. On paragraph 47, it stated that we need to find an in-year saving of £14 million. And then further on in the report, you said that in just in care home budget-wise, we were overspending by about £7 million on that budget alone. So how, you know, we're halfway through the budget financial year. Have we made any savings or striven to make any savings in that 14 million? And if so, where are they? And if not, how do we plan to turn it around? Because March or April time, we don't want to be in a bigger, worse situation. Thank you.
It has come down slightly. It's around 13 million now in terms of, it is moving in the right direction. We are working very closely, obviously across internally. We have got, you know, sort of some action planning, looking at, you know, sort of trying to understand, you know, sort of why those those costs have gone up, and putting in place mitigating actions. So within the department, we're meeting sort of 3 times a week to really look at that data, and match that against the actions that we're sort of putting in place in terms of mitigating some of that cost. So it is a very real issue. It's obviously quite a concern, but we are sort of meeting regularly, reviewing actions, and obviously sort of adapting those if those actions are working or not. But at the moment, I think the current information is telling us is that we have halted the increase, sign of sort of stabilizing, but we need to make sure now that it it begins to go back down into the right direction. I know we would probably sort of, and also to get a realistic picture of we possibly not going to by the end of next year have met pre-pandemic standards, but certainly we'll be expecting to recoup or control some of that spending.
Mr. Mullaney.
Thank you, Mr. Chairman. Nigel, from the figures published here, I think there's only 1% of care homes that were rated as inadequate, or 2 individual care homes, which is positive. And fortunately, from my point of view, one of those is the Ashton care home in John Street in Hinckley, which is in my area. And I know that there were issues with that home during the height of the pandemic in the summer of last year. And then in December, they had an inadequate inspection. And then in March, there was the inadequate inspection that was reported on at the end of July. So obviously there are things that need improving there. What we don't want to have, obviously, is a situation similar to what happened in the Limes nearby in Derby Road, which had to close, and we had to move all the residents out in the middle of the pandemic, which wasn't an ideal situation. So it was really just, obviously, you talk about the help you're giving to care homes. I mean, presumably that and the other care home that's inadequate is particularly getting a lot of support. I did see when the report was published that the management were quite mortified about what was happening, and they were saying they were going to put management plans in place to deal with it, because there were things like people missing medication for several days, which presumably if you've got rigorous plans in place, you can avoid, and strategies, you can avoid those kind of things happening. So really it's, are we making sure that we're giving all of the intensive support we can to them, just to make sure that we obviously don't have a repeat of the Limes at the Ashton home? Thank you.
Yes, thanks. Yeah, it's really a triangulation of work between ourselves, CQC, and the provider themselves. We would work, obviously, it's the provider's responsibility to make sure that they put in place a quality improvement plan to set out for us how they're going to meet, sort of and address any of the concerns or issues that might arise. And then we work obviously closely with them through our own internal qualities team, and obviously with CQC as well, in terms of improving that. And depending on the severity of any situation with any provider, sort of those meetings would be fairly regularly. I don't know whether Kate wants to add any commentary in terms of that.
Just to say that the report identifies teams within the council which provide support to care homes. So that not only includes the contract monitoring, which we have to do, and contracts monitoring colleagues work very closely with the Care Quality Commission, as do our quality team, who provide the sort of intensive support to providers to help them to address particular concerns or improvements that they could make. So we keep the quality of care home provision under constant review. Nigel presented within the report the risk rating that we attribute to each home to understand what level of intervention and oversight they require, and the authority has invested additional resource into officer time to provide the type of support and intervention that the member has mentioned, Councillor Mullaney has mentioned.
Mr. Hills.
Thank you, Chair. My question is just linking reports 1 and 2 from today. We've heard from November 1st, we've got a considerable number of new providers coming into the contract system. And then on the 11th of November, the regulations come into force where staff will need to be double vaccinated. I'm glad to hear about all the work you're doing with current staff to encourage them to take up the vaccinations. Are you reaching out to the new providers as well?
Yeah, the answer to that is yes. Obviously, that mobilisation work that's referenced in the report really looks at that ongoing conversation that we'll have now with new providers coming on to the new framework, and obviously, you know, sort of those are issues that we'll obviously be working quite closely with them to make sure that we're comfortable with what their position is.
Any further questions from members? That's good. I'll get to go then. Let's come into paragraphs 33 and 34, Nigel. I mean, I could write statements like this tomorrow, but what are they actually going to be doing that's different that will actually make this happen? And how are they going to do that in light of what you just said, that, as soon as there's a pandemic, the CQC run for the hills and don't visit anyone, whereas one would have thought that the time the CQC need to visit people most is in the middle of a pandemic, surely.
I can't really comment on sort of the CQC strategy and their reasoning behind it. I do think that it will change the way that we'll be required to give assurance of our own practices and work across a whole range of areas, from commissioning right on down. I think, and at the moment, is still very much in development as to how they're going to approach that. From what I understand, they will be, I guess, testing out the approach over this year, and it becomes operational really from, I think it's next year onwards. We do probably can take some educated guesses that they will be focusing a lot on, quite rightly as well, I guess, service user experience of services, to enable them to come to an assessment of a provider. But they will also be looking to the local authority processes and practices to make sure that we'll be compliant and can give them assurances. I guess it won't be quite like an Ofsted type thing, but it'll be, we will be required to, and we are in fact planning for, based on what we know, and we haven't got any concrete detail. We can only sort of look at what we think we know, to begin to sort of look at that now, to make sure that we're reviewing anything that perhaps we're not comfortable with. And there are areas such as commissioning, for example, the whole area of commissioning, where there's probably been not a huge amount of attention given, and we know that that's the case from work that's happened across the region. It's difficult to know how that will pan out, but we are obviously monitoring the situation and working with the CQC on that.
I don't think it's any more questions, so thanks to Nigel and thanks to Kate. Members are asked to note paragraph 89, the point that Nigel covered about the recommendation about reviewing the related costs be deferred. Are members comfortable with that for the reasons that Nigel provided? Okay, thank you. So we now move on to agenda item 10, which is the Leicestershire and Rutland Safeguarding Adults Board Annual Report 2021, which is on pages 37 to 48. And this is being looked after by James Fox, who's one of the board members. So over to you, James. You might just want to say a few words on the report, and then we'll see if there's any questions.
Yes, thank you, Chair. So this paper presents to overview and scrutiny to the committee the annual report of the Leicestershire and Rutland Safeguarding Adults Board for 2020 to 2021. It is the report of the independent chair of the board, who unfortunately is unable to attend today, so sends her apologies there. I guess overarching, clearly the period from April 2020 to March 2021 was a time of quite significant challenge, as has been mentioned already in this meeting, and as we're all aware across all services, but I think particularly in relation to working together and safeguarding those with care and support needs, that key element of the work of the Safeguarding Adults Board. A draft version of the content of the annual reports appended. It outlines the work of the board and of the partners that make up the board. It notes some of the strong partnership working during the period to support and safeguard people and oversee our approaches of working together. It includes an overview of the work around setting procedures, reviewing procedures, gaining assurance, auditing cases and carrying out safeguarding adults reviews, and also how the learning from those processes has been taken forward and some of the action taken in response to that learning. The covering report kind of identifies in summary that partnership working to safeguard adults with care and support needs has strengthened during the difficult circumstances of the pandemic. Our work has identified a concern that individuals and their needs can become hidden in what's been called hidden in plain sight, particularly within organisational and inter-organisational processes. And I think that's been a particular concern around those with learning disabilities. With still further work to do around the understanding and application of the Mental Capacity Act in relation to safeguarding. That has improved, but there's still work to do there. We've particularly considered assurance around people within the transforming care cohort of adults at risk. So that's those with quite complex needs, and ongoing assurance required that they're being safeguarded as well. Some of those areas that are concerned, so work to address hidden harm, including highlighting the vulnerability of particular individuals, such as those with learning disabilities, is a priority within the Safeguarding Adults Board's business plan for the current year. And that will include work to encourage developing and responding to professional curiosity and escalating safeguarding concerns as well. So this is the draft content of the annual report that's appended, and the final version will be a designed report with some pictures and things that aid readability, and the report's presented to Scrutiny. The independent chair will consider any comments from Scrutiny and amend the report as appropriate before it's published by the end of this month. Thank you, Chair.
Thank you, James. Do members have any questions? I think you've achieved a stunned silence, James, but I do think you win the understatement of the day award for we've gone through a challenging time. So thank you for presenting the report on behalf of the chair. But in the absence of questions, I think that implies that members are comfortable with the report as it stands. And thank you very much for that.
Yeah, thank you, Chair. Thank you.
We're now moving on to agenda item 11. Which is the annual adult social care complaints and compliments report 2020 to 21, which is on pages 49 to 72. And this is with Simon Parsons.
Thank you, Chair. So this report is, as I say, and is a report on complaints and compliments recorded during the last financial year. Just to remind members that there's a statutory duty for a complaints procedure for adult social care, which sets out a two-stage process consisting of local investigation, followed by a referral to the local government and social care ombudsman if complaints can't be resolved. Volumes last year were almost identical to 2019-20 with 196 complaints, so only very slightly up. It was 194 the previous year. I guess the wider context is important to note. The sort of wider landscape of complaints in the authority was a 21% increase. So set against that, it's encouraging to see that that increase has largely been contained in kind of social care. And just to give some context, that continues to be around just under 2% of the overall numbers in receipt of kind of long-term support, which is how we kind of benchmark sort of what proportion need to make complaints. So relatively low numbers in the grand scheme of things. Of the complaints that were looked at, fault was identified in 39% of cases, and that's slightly down from the previous year where it was 44%. And very much in range with the previous few years. It's been pretty static in that kind of 35 to 40% territory for many years, and that's kind of typical range, I guess, for other authorities. Tends to be high. There always tends to be a a higher uphold rate in the areas of kind of social care, which are a bit more nuanced than, say, some of the more areas that are very much black and white around process and things. So so it always tends to be a slightly higher uphold rate in kind of social care areas. Approximately 5% of the complaints last year progressed to the local government and social care ombudsman. So 10 cases that they opened inquiries on. And again, that's down from the previous year. And again, good to see relatively low numbers escalating up to the ombudsman. That kind of has reduced a bit for a number of reasons, but one of the key things there is the introduction of the kind of senior management review, kind of more belt and braces before it goes to the ombudsman, that we put in place about 18 months ago, and certainly that is reducing cases that escalate to the ombudsman, and indeed cases where they go on to then find fault. The Ombudsman issued 9 final decisions last year, with 4 findings of maladministration, and those are detailed in your papers across pages 67 to 68. Response timescales, probably won't be a surprise that there was some pressure on those, particularly during the height of the pandemic. So there was some pressures on service managers responding to complaints, perhaps unsurprisingly, but again, overall, still 70% of complaints responded to in 20 working days, 90% in 40 working days. So very good numbers at that kind of those kind of indicators, and just 5 were outside of the statutory complaints procedure of the 65 working days. So still fairly healthy, although some pressures and some deterioration from the previous year on that area for fairly obvious reasons, I guess. As always, the most common area tends to be around assessment, care planning, those sort of areas. It's probably the broadest area, but certainly the area that comes through highest probably most years, really. This year's marks the first year that we've kind of put a full data set of trying to map complaints at a kind of district level. That was something that the committee asked for 2 years ago, and we did a half year's version last year, and this year's the first year where we've had a full data set around that. It's obviously, as it's fairly new, it'll still take some time, I think, before we can do any kind of wider trend analysis or really get under the skin of that. There's no obvious outliers within that, but it's one that will probably build up over time and start to assess some of that trend. Possibly some further work with looking at kind of mapping the numbers against the kind of proportion of service care users, which we haven't done yet, which might show a bit more differentiation. But as I say, it's kind of work in progress there. But again, no obvious outliers there, and a lot of that's also kind of from the instinctive analysis that we do around pockets of where there's pressures and there's nothing strongly coming through at a locality level. The report features this year some good examples of learning from complaints, and I've included again some case studies which hopefully bring to life some of those stories. These are cases all at local investigations sort of stage where service managers have kind of done more than just kind of resolve the immediate issue, but actually looked at those. What are the underlying causes? What do we need to do differently? All that good practice around trying to mitigate against the same things happening again. And we're gradually increasing the numbers of cases where it's very obvious to myself and my complaints officers of where learning has been grasped. So what we tend to map through there is within the complaint responses, the number of cases where it's very clear that we've picked up some wider learning, whether that be kind of staff training, team training, whether it be policy changes, process changes, all of those kind of things, which are kind of hopefully will resolve things for the many rather than more than one. And again, that rose to 32%. That's been increasing gradually each year, those cases. We also capture compliments, and again, that's really important to bring balance to some of the work we do. As always, it takes a lot more, I think, for service users and families to go to the effort of writing in to thank us than it does to tell us where something's gone wrong. I think that's just human nature. But again, encouraging to see that we picked up further an increase on that with 111 compliments recorded across a range of social care services, really, and good to see that as context of some of the good work that went on in challenging circumstances. I guess the kind of final thing I just wanted to comment in is, again, recognising that last year the committee asked for a bit of an update or some analysis of any impact of the design changes around hospital discharge arrangements this year. And again, I've looked at that. We kind of have a category around all things to do with hospital discharges in terms of numbers of complaints generating. And I'm pleased to report no big impact. Those numbers were very much similar to last year. Again, talking to the department, there were clearly challenges going in from the changes in discharge arrangements, but fundamentally what it looks like is that it's a good local resolution has kind of preempted those needing to translate it into the formal complaints territory. So yeah, no significant impact in terms of formal complaints in that area. I think that's the main messages, Chair, but as always, very happy to take any questions on any of that.
Thank you, Simon. Just before I throw it open to members, just looking at paragraph 16, I was getting quite confused. So it said that 63 complaints, 32% were handled within 10 days, 137, 70% within 20, which to me adds up to 102% and 200 complaints when we only had 196 in total. And we still had 5 that exceeded the 20 days. So am I misreading the figures, or is it just the percentages and numbers in the report need correcting?
Just going to look at that now, Chair. Yeah, I might need to take that away and just double check the figures on that to give an answer on it, if that's okay, Chair. Just to check the maths behind the scenes on that.
Yeah, it doesn't need an answer. It's just if the report's inaccurate, if we could correct it just to the right figures. Just so
yeah. Normally when it's 1% either side, it's sometimes rounding issues, but yeah, of course, no, yeah.
And I wasn't trying to trick you. Literally, I must have rested my computer on paragraph 16 and it just hit me in the face. So I wasn't trying to be clever or catch you out.
No, that's fine. I'll take a look at that. Yeah.
Thank you. Do members have any questions? Amanda?
Yes, I'm looking at paragraph 3.3, table 3, when it talks about causes of complaint. Do you have that, Simon?
Just going to it now. Yes.
Okay, just in terms of that, and you know, I think I probably know the answer to this question, but it talks about quality of work being by far the main reason for complaint. Just in terms of that, is there an analysis done on that in terms of whether those are individual failures of particular workers or whether they're more systemic process-driven issues?
Yes, there is. I mean, it's so we just to kind of to work through the categories that we use there broadly are mirrored towards the same ones that local government ombudsman use, so we can hopefully map those through. So, and that area of kind of that quality of the work is by far and away the biggest one. So it'll cover all things from accuracy of information in report gathering to right the way through to consistency of timings of carers at home calls, all of those sort of things. So it's a big area, hence why it's largely biggest. In terms of do we look at whether those are individual or more collective kind of team issues. I think that's kind of where that analysis that I alluded to around the where we draw the learning from comes through. So where it's kind of one-off issues that are simple users, it's less likely to that within the response we kind of pick up that there's any wider work needing. So sometimes it is simple. It is as simple as an error by a user that doesn't have a track record of any particular errors there. It's a one-off mistake. Other times, obviously, repeat issues or it's issues with knowledge of procedures or policy or anything like that clearly indicates some training. So that kind of leads to that wider need. So yes, it's pulled through in terms of it within the response, and then that translates into how we code them as to whether or not we have just simply resolved the complaint or whether there's wider learning for the organisation.
Thank you.
Are there any other further questions? Oh, you see, I think you defeated us, Simon. So thank you very much for the report and the answers. We'll now move on to the final agenda item today, which is performance report for Q1 2021-22, April to June, as set out on pages 73 to 88. And this is in the very capable hands of Matt Williams. Matt, you don't generally get many questions, so I've got each member today to assure they're going to ask you at least 10 each. But we shall see at the end if they're going to support me on that one.
Thank you, Chair. Good afternoon, everybody. Okay, so yeah, the Chair has outlined the report. It's the regular performance report for adults and communities, and in this case, it covers the first 3 months of 2021-22. That is April to June. The metrics are detailed in Appendix A in detail, and these are based on the performance kind of measures of the adults and communities department for the year. They're generally reviewed through the annual business planning process to reflect kind of key priorities of both the department and of the council in general. Being a new year, clearly new targets have been agreed, and these are to maintain areas of high performance and shift those areas perhaps not performing so well towards more national or regional averages, or preferably higher, obviously. I think it's probably worth noting, and I get the impression most reports have done this today, that the ongoing COVID-19 pandemic has obviously impacted many areas of performance through the last 18 months, and this has been reflected in the commentary throughout the report. So overall, there were 17 metrics which had a red, amber, or a green rating attributed to them. And of these, 11 or 65% were classed as green and meeting or surpassing the target. The remaining 6 metrics, performance is currently falling short of that target. So I'll just take a moment then just to highlight a few examples from within the report, and starting really with kind of heritage side of things, the communities and wellbeing. As we've noted in previous reports, again over the last 18 months. Comparison of activity across kind of heritage and library sites has been somewhat tricky through the pandemic due to the inconsistent nature of opening times for physical attendances. We know that most of these started to reopen around about mid-May this year. So whilst it hasn't been a full quarter, we can see that the numbers are somewhat higher than the same period last year. As can be expected, the level of volunteering, as an example, that has started to increase, 1,600 hours in the latter part of the quarter since reopening. And another area, despite the physical visits to libraries moving back towards where they were pre-pandemic, the use of e-loans, which I know I do touch on in these meetings regularly, they continue to soar. We saw 222,000 e-loans during the first quarter, which is 19% higher than the equivalent period last year. So move on, we'll have a look at some of from the adult social care perspective. 2 metrics that focus on the outcomes of the reablement service. Both saw performance decline last year. These were 2 areas which were particularly hit by COVID-19. And the first of these is the proportion of people who have no ongoing needs after a spell of reablement. We generally perform very high when we compare ourselves nationally. We felt around about 78% at the peak of the pandemic last year. We've seen some improvements. We've seen improvements through the first quarter of this year, and at the end of June, it was up to 85%, which is meeting the target. I think it's just about on the target. The other area relating to reopenings is where we monitor the success of the service around the proportion of people still living at home 3 months after their hospital discharge. Performance has again steadily improved, and then at the end of the quarter was 87%, which again is meeting this year's target at this stage. Probably worth noting actually that these are both national metrics, and it will be useful to see the impact of COVID-19 on other local authorities in this area when those figures are published later in the year. And actually, they will be presented, as an aside, they will be presented to the committee in January. Moving on then perhaps to permanent admissions to residential care. Both metrics, that's for working age adults and older people, highlight a higher level than the maximum targets that was been agreed. So for working age adults, say 18 to 64 age range, this actually may be down to recording practices on our databases, and that's being looked into at the moment. For people aged 65 or over, the full year forecast remains below 800, but is actually looking like it could come in around about 2% higher than the target. During the earlier stages of the pandemic, so kind of through spring and summer of last year, our review resource was redeployed to support the number of hospital discharges that the department were dealing with. And as such, the proportion of people with an annual review of their services was at 63%. And what we've seen during the first quarter of this year, 21-22, we've seen that started to improve like other areas, and currently stands at 69%. So to conclude, performance against the majority of metrics has started the year well. There are obviously some areas that we've noted where improvement is required. Regular monitoring continues through the year on a regular basis. And in addition, something that I've noted a moment ago, the 2020-21, so that's last year's national figures, will be published later in the autumn by NHS Digital. And as always, we will bring them to the committee in a report in January. These will be interesting to look at to see, as I said, the impact of the pandemic across the country and how we've all fared with it. I think that's about it. Thank you, Chair. Welcome any questions, should there be any, or comments from the committee.
Thanks, Matt. What do you mean, should there be any? Of course there will be. They're all looking at me with bated breath.
Queuing up.
Why they go, and I will go first. On the libraries, one thing, I don't know why it's just hit me now, it's never hit me before. We show total community library issues for children and presumably for adults. Do we have any comparable figures, because we've gone through this and people aren't going on the e-loans of whether they're children's books or adult books? Because one of the concerns I would have personally is I think, children reading from an early age is beneficial for them throughout their entire lives. And do we have any comparable statistics for the impact on children's reading levels through the e-book loans or the e-loans? Are they children's books or adult books, for instance?
Thank you, Chair. Yeah, my understanding is that we can break down those e-loans figures into junior or adult loans, and that can be done. I don't unfortunately have the figure to hand at the moment, but that is something we can do. How that would then compare across other authorities, I'm not sure, but certainly we can look into splitting the figure into junior and adult loans. I don't know whether Nigel has anything further he'd want to add to that at all.
Yeah, I mean, Matt's right. And I think just in terms of regional perspective, I think we compare generally favourably with that. We have actually invested in e-resources, particularly during the pandemic. There was little point in putting resources into physical books when libraries were closed. We rechanneled some of the book fund into e-loans, and that's followed through. I think just a general point just about children's loans is that it's sort of like one of our strategic ambitions is to make sure that our libraries are family friendly, and we do put a good proportion of our resources into children's books and loans, and I think certainly pre-pandemic it was one of the areas where, you know, sort of generally library loans probably across the country in the main were falling. Certainly children's loans were, certainly in Leicestershire, you know, sort of stable if not improving, and I think that's just a result of, you know, where we've decided to you know, prioritise our spending.
Thanks, Nigel. Thanks, Matt. I mean, if we could perhaps have a figure at the next time we look at these figures, not as part of the chart, but just as an impact, it would then just strike me that if we have seen perhaps a massive reduction in children's issues in one way or the other, you know, it may lead this council perhaps to do some promotion to try and, you know, get children reading again, or perhaps liaise with the schools to see if there's been a corresponding increase of children's loans, perhaps through school libraries. I think it's, you know, something that will be extremely valuable for the future. Sorry, Mrs. Radford, I think wants to respond first, and I'll go to Mrs. Wright.
Yeah, can I just say that we did do through the summer holidays, didn't we, a children's reading scheme, which was well taken up. And quite a lot of that was by e-book, because of course the libraries weren't open sufficient, but I do know that was well taken up.
Thank you, Christine. Mrs. Wright.
And I may have not heard you mention this issue, so apologies if I'm repeating something you've already said, but in terms of paragraph 17 and the avoidance of permanent placements, you indicate there that there has been 12 out of a target of 17 admissions. Is that in somehow, you also say there that you're looking at those irregularities? Is that in some way related to COVID?
Not necessarily. There may be a COVID aspect to it. Social workers record on our client database when somebody goes into a residential placement, and there are certain types of residential placements that they may record, and different types, and it is that area that I suspect where perhaps recording irregularities need to be checked. So whether it's a temporary or more of a permanent placement, it's that kind of area we need to be looking at. Now that might be slightly caused or influenced by COVID issues and challenges, but that will come out with the checking. As said, 12 is a lot for one quarter and more than we would expect. Hence the investigations.
Is that something that you'll be able to update us on in due course?
Yes, certainly. When I bring the next report back, we will be looking at the April to November position, and for sure it will be in the report, both as a number and the ongoing investigations recording.
Thank you very much.
I think I'd just add to that as well is that what we do know is people being discharged from hospital are being discharged with more complex issues, which again may have an impact.
Happy, Amanda?
Yes, and that final point actually was what I was getting at, and whether that is actually some kind of administrative error or mischaracterization of what a permanent placement is from an administrative standpoint, or whether it actually is a pattern that we're going to be seeing a little bit more down the road. And so I guess that was where my question was focusing.
Right, no further questions, members? Thank you very much, Matt. I see you got some questions this time, so that'll teach you to come along. Thank you, Nigel, as well. The date of the next meeting is scheduled to take place on the 1st of November 2021 at 2 o'clock. There are no urgent items under agenda item 14. If I could first of all thank any members of the public who may have tuned in today. I think it's always hopefully you do find these interesting and useful. And could I thank all the members and officers for their input into today's meeting. And with that, I declare this meeting closed. Thank you all.
Thank you.